Hi from an absolutely gorgeous but very, very cold rural Devon. It's just such a gorgeous part of the UK. I'm here for a couple of days work and on my way back now to Bristol Airport. Here are my top tips if you're thinking about a lip filler treatment. You know I'm going to say this: seek a medical practitioner with lots of experience, whether that's a doctor, a dentist or aesthetic nurse, and ask to see the product it's going into your face. Try not to go if you have a healing cold sore or any kind of infection, or you're taking antibiotics or steroids. Put off your treatment until everything is completely settled. If you're in any doubt, ring your practitioner. They'll always give you advice because they don't want you to have a wasted trip, and also they want to maximise the appointment time as well. The other thing I would say is don't stop any prescription medicines. If you're in any doubt, ask your practitioner. Try not to have much alcohol the night before your treatment because we know it increases bruising, and be aware that you might get a bit of a fright when your treatment is done because there will be some swelling, there can be a little bit of unevenness, and there's a chance of bruising. So really it's not a quick lunchtime procedure in terms of trivializing it or no risk. There are potential side effects, and the things you can expect is tenderness, swelling and bruising. You may not get any tenderness, but you may not get any bruising, but you really just have to factor those in. Also have a look at your facial proportions before you go in, and have a look back at some photos or things you'd like to achieve, because we know over time the lips thin and the support around the mouth, called the perioral area, decreases as well. If you want Angelina Jolie lips and you've got a tiny chin, the proportions won't be right. So really have a look at your face and decide what you would like to achieve. And go gradually. It's a marathon, not a sprint. And you can always do a small treatment and wait and do another one. People will often ask me if they can just have half a ml, and that's 1/10 of a teaspoon. And if I have to divide that into the 4 areas, upper and lower on both sides, it's really not enough. So the vast majority of people need at least a ml. And if I pucker, I'm losing some support around my mouth, and I've had that treated with dermal filler from a colleague a couple of years ago. I'm beginning to lose some support. I do have that treated with toxin as well. But if you're more mature and you've lost some support, and when you pucker there's lots of lines and lots of lines here, you're probably going to need more than 1 ml. And it doesn't all have to be done in one session. My approach to lip filler is to go conservatively. I'll make a little entry point either side here, and then I'll use a cannula and I'll sneak in very gently into the lips. I'm going to put on a strong numbing cream. I want to go very gently. It's still sensitive. The lips are full of nerve endings, and so we try to make that as comfortable as we can. So I'll come in with a cannula and I'll kind of sneak in front of the muscle underneath the skin of the lip, and I'll go very gently and I'll fan it out, and from the same entry point I'll do the bottom lip. And then if you need support around the mouth, I'll use that cannula and I'll go above to this area here. If somebody wants a sharper Cupid's bow, we can do that refining with a tiny needle. And also if somebody wants these little columns here called filtral columns, you can make those, but we don't want to make them in somebody who's never had them. We want to just go very gently. If somebody, as we mature, is getting very long from the nose down to the lip, and that's really lengthening and the chin is turning up, the proportions are going to be off. So all of those things are going to play a part in it as well. With your aftercare, be aware you may have certainly a couple of days of swelling or bruising. So build that in if you've got a big social event or a family event or a wedding, and don't panic the morning after you've had lip filler. All practitioners will tell you, look, it's going to be swollen. You're going to wake up and go, wah, and then it really takes a bit of time to settle. So be as prepared as you can. Have your breakfast as well. We tend to see, sometimes rarely, probably once a year, somebody who feels a bit faint because the lips are sensitive. So ask your practitioner for their experience. Ask to see the product. It should have local anesthetic in it. The vast majority of hyaluronic acid products do. Don't let anyone inject anything other than hyaluronic acid in your lips because it's reversible. Go gently, go subtly. Don't have too much in one session. Don't have huge expectations that you're going to fix the whole mouth and chin area and all the support around the mouth with 1 ml. It can't be done. And then seek your practitioner's advice in advance of your appointment if you need any special tips or hints. Take care. Bye.